Dialysis has become, they think it's a business for a kidney doctor to run a dialysis center or to have patients on dialysis. So there is a institute, I won't name the institute, but there's an institute in India where they've opened multiple branches, and they're saying that we will stop your dialysis. They have this hypothesis that the skin is your third kidney, and if you sit in a bathtub with hot water, you will sweat out all your toxins and your creatinine levels, urea levels will go down. Is absolutely false. It's a full scam. Patients go here, spend thousands of pounds or lakhs of rupees, and they come back, get admitted in hospital, and they've just damaged themselves further. I've done a lot of interviews with patients and put it on YouTube who've gone to these places, and they've all said that they lost so much money. It's more expensive than dialysis actually. Same with the you go to a cardiologist and the biggest fear patients have is, oh, he's going to put a stent in me. What do you have to say about that?
I know it happens. I know there are some cardiologists who over recommend intervention.
Yeah.
Today we're going to do a more spicy episode. We're looking at things that we have come across that we would consider controversial. So we're going to be talking about some of the scams, some of the uncertainties, and some of the controversies seen in Asia and seen here in the UK as well. So Arjun, what do you think? Why do you think we see scams and controversies in the kidney and heart space, and why does this happen?
Because patients want hope. Patients are going through diseases which are very chronic, so they want someone to tell them, I can fix this in 1 week, when that's not true. But it's hitting that emotional aspect of patients where they see hope by someone without validating if it will work or no. So I'll give you an example. We had I know a story about a patient who had a kidney transplant and then went to India.
Yeah.
And one Baba told him that I will make all your medications stop. And he did that. 2 weeks, he stopped all his immunosuppression medicines, which is important in a transplant patient. And then he comes back and his kidney had failed. His transplant was rejected by his body because he stopped taking his medications. So for those 2 weeks, he thought he's doing well. He stopped all his medications. The Baba has healed me. But what happens afterwards, the Baba doesn't know. And it's the patient who has to suffer. So it's very important to talk about misinformation that's happening both in kidneys and in heart. For example, I see so many people now saying that cholesterol is a scam. Cholesterol does not cause heart disease. So what do you think about that?
Yeah, this has been a pretty damaging controversy that has been around, I'd say, for probably since as long as statins have been around.
Yeah.
So I think the black and white thing as a cardiologist that I would say is that if you have heart disease or you've had a heart attack, you should be on a statin to lower your cholesterol.
Yeah.
Because whatever your cholesterol was when you had the heart attack, it was too high and you had the heart attack.
Yeah.
So it should come down. And we have very good evidence from thousands of patients reproduced over and over again, which show that if you have had a heart attack, you should be on a statin to bring down your cholesterol if you can tolerate it. Now, the controversy comes in because more and more patients begin to think, oh, okay, I want to try and reduce my heart health. And much of that is appropriate because if you have high cholesterol, your risk of having heart problems is higher than if you didn't have high cholesterol. So we're now looking at primary prevention. So can you stop a heart attack in someone who hasn't had a heart attack? And this is where sometimes the data can be more gray. And simply giving everyone a statin, giving, a young 10-year-old child a statin who's got no risk factors would be inappropriate. Right? They don't need it and you're over medicalizing them.
Yeah.
On the other end of the spectrum, if you've got a 50-year-old smoker, diabetic, hypertensive, who's got a strong family history of heart disease, and they've got a high cholesterol, bringing that cholesterol down is very likely to be associated with a lower risk of heart attacks. And we've seen that in some studies.
And you calculate the risk, right? A Q risk score or some other score where you calculate the risk of having a heart attack in 5 years or 10 years. And that's how you start their medication. And that's preventive medicine, right? So you do that to reduce the risk of heart disease or stroke. But for someone else, it's like, oh, he just wants to get a commission from the pharma company and start you on this medication. But that's not true, isn't it?
And I think it comes with better communication. So as doctors, we need to communicate with patients better because you're absolutely right. There are risk scores that in the UK, we say, okay, your risk of having a heart attack in 10 years is 4%, 2%.
Yeah.
And if it's high, that person should be recommended to go on a statin. If it's below the threshold, they shouldn't be recommended to go on a statin. However, that probably is an oversimplification, which is where the problem comes in from. Let's say you are looking at your Q risk score and it's low. Let's say you've got a 1% risk, right? But you aren't only concerned about your next 10 years. You potentially have got 20 years, 30 years, 40 years, 50 years, 60 years of living left to do. And we don't have the data to say to you, Arjun, that if you take a statin today, your 50-year risk of a heart attack will be significantly lowered.
Right.
So this is where the grayness comes in. And I think this is the role why you need to have a good conversation with your doctor about what your goals are. And if your goals are to lower your risk of heart disease over a long period of time and you've got risk factors, it can be reasonable to take a statin. Similarly, if you don't want to go near it and you don't want to, that can be understandable too.
Then you just monitor, right? You fix your lifestyle, diet, and you monitor, and then keep checking your risk every year.
Exactly. And I think statins should not be a substitution for diet and lifestyle.
Yeah.
And that often goes back to what you were saying about a shortcut.
Yeah.
And that's why sometimes people misinterpret statins as a scam, because it's a shortcut for good diet and good lifestyle. It shouldn't be that. It should be on top.
The next thing I want to talk about is dialysis. Dialysis has become, they think it's a business for a kidney doctor to run a dialysis center or to have patients on dialysis. So there is a institute. I won't name the institute, but there's an institute in India where they've opened multiple branches, and they're saying that we will stop your dialysis. They have this hypothesis that the skin is your third kidney, and if you sit in a bathtub with hot water, you will sweat out all your toxins, and your creatinine levels, urea levels will go down. And it's all over YouTube, got millions of views. And what that guy is doing is giving hope to patients, false hope that they can stop dialysis. The other thing patients think is that if I do dialysis 3 times a week or 2 times a week, I don't need to do that. I can just do it once in month, once in 2 weeks, once in 3 weeks. That's not true. You know, what a dialysis machine does, what your kidney does, a dialysis machine can't do that. So 3 times or 2 times a week is minimum that you have to do.
It's not even enough for what your kidneys do.
Exactly. It's not even enough. So this guy is saying that he's going to stop your dialysis by making you sit in a bathtub. Is absolutely false. It's a full scam. Patients go here, spend thousands of pounds or lakhs of rupees, and they come back, get admitted in hospital, and they've just damaged themselves further. I've done a lot of interviews with patients and put it on YouTube who've gone to these places, and they've all said that they lost so much money. It's more expensive than dialysis, actually. So yeah, they're playing with the emotions, with hope, which is a strong emotion. Yeah.
Wow.
Yeah.
I mean, that is terrifying to know that there are people out there doing that.
Same with the, you go to a cardiologist and the biggest fear patients have is, oh, he's going to put a stent in me. What do you have to say about that?
Yeah, I think it's, I know it happens. I know there are some cardiologists who over-recommend intervention.
Yeah.
And I think that never is the best strategy, even if you are trying to be a businessman as a cardiologist, because you might, in the short term, get the money for one extra procedure, but you've lost the trust of that patient.
Yeah.
And then you've lost the trust of every person that person communicates with. And so I think when a doctor is also making money from a treatment, you've got to take a holistic, long-term view that if you are the best cardiologist giving the cleanest, neutral, evidence-based advice, that in the long term, that is the best thing for your career.
Yeah.
And so that is certainly the best. Now,
sometimes less medicine is better, isn't it?
Absolutely. And the problem is, for any man with a hammer, everything looks like a nail.
Yeah.
And so if you have chest pain, angiography. If you have shortness of breath, angiography. If you have got a stent in and it's been 5 years, angiography. And certainly in a lot of these situations, it's never that black and white. And so that's why I think some level of audit and governance is really helpful.
But wrong people exist in every profession, right? Like if there are 95 good doctors, you might see 5 bad doctors. So we shouldn't generalize the whole doctor community based on that. So not every cardiologist is going to put a stent in you if they do an angiography. Most people do look at the risks and the benefits and then go ahead and do that. But this misconception that every cardiologist is out there just to put stents in, I think is wrong.
Yeah, I think it is wrong, but I think from the patient's perspective, it is hard for them to know the difference between a good cardiologist and a bad cardiologist. Yeah. Same with a kidney doctor. And I think that's why conversations like this are so helpful.
Yeah.
Thank you for giving up so much of your time to join us, because it allows not just us, but everyone listening and watching to understand how conscientious you are and how much you think about the patients that you are treating when you do this. And so I think it's certainly helpful for anyone who wants to get medical advice to understand who you're going to, what their track record is, what they've done in the past, what their friends think of their cardiologist, and do that research. If you think about when you go to buy a car, if you think about when you go to buy a watch, how much time do you spend looking at reviews? How much time do you spend comparing different ones, testing, speaking to people? People need to be just as rigorous about choosing their doctors.
Yeah. I do hope in the future that the biggest problem with healthcare industry, I feel, is like everyone has their own opinion.
Yeah.
Everyone is different. Even though we have set guidelines, everyone does things differently. And that confuses patients because they don't know who's right, who's wrong. And that is a problem, definitely.
Great. Well, I hope conversations like this help bring all this to the surface and empower anyone listening to ask their doctor, why are you doing that? Why do I need an angiogram? Why do I not need dialysis? And where is the evidence behind this? And always push and always feel that you should be able to ask those questions. And if your doctor's not letting you, then that should be a red flag.
Yeah, always ask questions. Questions are welcome. We want you to ask questions. If you ask a question of why you're starting me on an SGLT2 inhibitor, I will be much more happier rather than me just starting on you. Yeah.
Absolutely.
That improves compliance also.
Yeah, it's a two-way relationship.
Yeah.
You know, the person who wins the most from any of these treatments is the patient. So understanding it is crucial to compliance, as you said.
Yeah.
Great. Well, Arjun, thank you so much for joining us for these series of interviews. I've certainly learned a lot, and I hope that this is a collaboration just like how the heart and kidney work together and something we can do again.
Definitely. Thank you so much for having me. It was a pleasure to be here.
Great.
Thank you.
Thank you.